Hello, everyone, and happy Monday. This is Dr. Rebecca Glasser. I'm a plastic surgeon. I've been practicing for over 20 years now, and I specialize in breast cancer reconstruction. And it is October, it's Breast Cancer Awareness Month, and I'm so excited to have a special guest here, Therese, who's going to talk a little bit about her story with breast cancer and how that all came about. Our hope is that we can bring you all some wonderful survival stories in the month of October and bring just a little extra hope to you during Breast Cancer Awareness Month. So Therese, we're so happy to have you on board as our guest today.
Thank you.
So
Thank you.
if you would just tell everybody a little bit about your story with breast cancer, how you were diagnosed and what you went through.
Okay. Well, it was in 2012, and I, am a healthy person. I pride myself in always exercising. I exercise my whole life. I've maintained a healthy weight. Not that I always eat the best, but most of the time I, eat healthy and don't smoke, don't drink in excess. I mean, I didn't have any risk factors except that my mom had breast cancer. And so I felt this lump. I thought, it's time for me to get my annual mammogram. So I went in, and the doctor, the radiologist, came into the room after my mammogram, came into the room that day and said, it looks like you have breast cancer.
And Therese, you're a nurse and you work at our local hospital here in Grand Junction, Colorado. So you had a lot of knowledge and background in medicine.
Yes.
So there's a lot of different treatments that women go through for breast cancer.
Yes.
What did you undergo?
So for me, it was a lot of just hard decisions to make. And what I ended up ultimately doing was the double mastectomy. And the main reason I did that is because I just wanted it all gone. I didn't want to have to worry about recurrence, because also my cancer, it has the highest recurrence rate, which is triple negative. And so I was scared. I just wanted it gone. So I did the double mastectomy with reconstruction, because I'm also a yoga instructor, and so having to deal with like prosthetics I thought would be a nightmare. And so I just did the reconstruction. It was a 7-hour surgery.
Yeah.
It was a lot. It was very difficult. And that was just the first part. And then I had to follow up with 6 months of chemotherapy. And the chemotherapy, I lost my hair. My skin was just dry and icky, ashen. I lost my eyebrows and my eyelashes. I had brain fog. I was very tired. I mean, just exhausted. And I also, the big one was peripheral neuropathy, where I just had pins and needles in mostly my fingers. And as you said, I'm a nurse. I'm a NICU nurse. And so to do that fine motor skill, I thought, this is so scary for me. And I went through the 6 months, and at the end, I thought, what can I do? Why did I have to go through this, and what can I do differently?
Yeah. And I think that, Therese and I, we've both been in medicine for a long time. We believe in traditional medicine, whether it's surgery or chemo or radiation or long-term treatment like tamoxifen in order to treat your breast cancer. The key is getting rid of the cancer, right? But I think that for a lot of people, what we also don't realize is sometimes the cancer treatment itself can have its own set of side effects. And you heard a little bit about Therese's story, because, boy, those side effects are tough on so many parts of your body, because along with killing the cancer, which it does a beautiful job with, it also kills a lot of normal cells within the body. And so I think it's hard sometimes to get back to that level of normalcy for being able to have a good quality of life and be able to live your life now that you're a cancer survivor. So what are some of the things that you did in order to improve your quality of life after the cancer treatment?
It was a kind of intensive search. I spent quite a while looking, different foods. They talk about so many different foods that are helpful. And so I looked at that. I did that. I followed some of the food recommendations. I read some books, but everything that I read and everything I did, there was never any real definitive research that said, oh, this will help to prevent cancer growth, breast cancer growth. And so until I finally found LifeVantage, and a friend of mine introduced me to this, and being the nurse and the science geek that I am, I did my research on this product as well. And the Vitality Stack, which is basically 4 different products, it covers all of everything that you need to maintain your health. It addresses your gut issues. It addresses the oxidative stress that you have. It helps with your energy, and then also brain and heart health with our omega. So these 4 things I started to take, and I couldn't believe the difference that I experienced, overcoming all of those side effects from breast cancer and chemo,
Right. And just to be clear, LifeVantage is natural products. They come from the earth. They do no harm. And I think that's one of the things that we both really love about them. But at the same time, because we are considered a vitamin supplement, we certainly can't make any claims that we cure, mitigate, or treat disease, or that we prevent breast cancer in the future. But let's kind of run down each of those products and talk about how those specific products, the Vitality Stack, have helped you. So Protandim, the NRF2, NRF2 is the first product. So how did that product help you with things?
And so that one, to me, it was just like flushing out all the gunk that was in my cells, all of that buildup of free radical damage, and certainly damage from chemotherapy. It just was flushing out my cells. It also has very strong anti-inflammatory properties, and inflammation is a part of surgery and healing. And so, doing all this work, reconstruction, it really just helped to get things to heal and to reduce the inflammation.
Right. And I would totally agree with that, because you think about it again, we believe in chemo, we believe in surgery, but you can imagine the toxins that are going on within her body that killed the cancer, but also killed a lot of normal cells as well. And so one of the things Protandim NRF2 does is it helps to get rid of those toxins, flush out those toxins, and to activate your body to turn on those natural enzymes, those natural survival genes within your body to allow for your body to heal yourself. And NRF2 has been our flagship product. It's our product that's been around the longest, and we're both huge believers in that.
Yes.
Now, another part of that Vitality Stack is our Protandim NRF1, and I think that one helped you quite a bit too after surviving all this.
I know my husband, he would tell me, you really are asleep a lot. And when I went through chemo, I was probably sleeping 12, 14 hours a day, which is not like me at all. And even after I finished chemo, I still, I can remember, every chance I could, I would take a nap. I would sleep in, every day that I wasn't working, I was sleeping in till 9 or 10 o'clock in the morning. And once I started the NRF1, I didn't have that strong meat, I felt like my sleep was better and I didn't need to sleep as much. Mm-hmm. And of course, the flip side to that was that my energy levels just went up. I mean, I'm a yoga instructor, right. And I, was seriously considering not teaching yoga anymore. Right. And I was having a lot of pain in my low back as well. And that, has really reduced so much, and it gives me hope that I can continue teaching yoga for many more years.
Right.
Yeah.
So protandom nerve 1 is the second switch that you want to flip. And if you go back to like 8th grade biology, okay, that goes to your mighty mitochondria. That's the energy switch. It creates more mitochondria, more ATP, more energy. So it helps with energy during the day, but it also helps with your quality of sleep during the night. And so these two work in tandem. They're working together in order to get a better outcome. And you don't have to have breast cancer to have a loss of energy as you get older. I mean, you hit that 40-year-old mark and immediately you're feeling a little more tired. You're needing more naps. I know my father, who's 93, he takes a lot of naps, right? So we need that as we get older. Now, the third part of the Vitality Stack is our probiotic. And this one, gosh, after undergoing chemo, that's a super important one.
Right, because chemotherapy, as you said, it destroys the cancer cells, which is, of course, what we want. Mm. But it also destroys any rapidly growing cell in your body. Well, all of the healthy gut bacteria that you have falls into that category. Right. So basically, my gut was wiped clean. And what typically can happen is you can get bad bacteria in your gut. And so I started to take, I've always known that probiotics were important. And so once I finished chemo, I was on them, but I was spending a lot of money on what I thought were good probiotics. And once I learned about our company and our probiotic, I learned that I was only getting about 4% effectiveness into my gut, which is where they have to work. The stomach acid destroys probiotics. Probiotics are bacteria. That's what our stomach is supposed to do. But our company, our probiotic is coated with a BioTract coating, and it actually protects the probiotic. So it gets into the intestine, and so we have like a 60 to 70% effectiveness rate. And boy, I could really tell a difference when I started on our probiotic.
Right.
It helped me.
Yeah. So chemo, certainly, hopefully, not many of you have to go through chemo, but that wipes out all of your normal gut flora. But for the rest of us, I'm a surgeon, so what's the first thing I do before I take you back to surgery is I give you an antibiotic. So if you've been on an antibiotic, again, that's killing off all good bacteria. Medications can change your gut flora. Stress. The year of 2020, I think all of our gut bacteria has been changed a little bit. So probiotics, I think, again, whether you're a cancer survivor or any of us, probiotics are so important for our brain health, for inflammation, and really for our immune system as well. So probiotics are a huge piece of that. Mm-hmm. Now, the last piece of the Vitality Stack is our omegas, or what we call our Omega Plus. So tell us a little bit about that.
And, omega is basically fish oil. And so the fish oil, we all know that fish oil, most of us do take fish oil, but a lot of people have gotten away from it because they have fish burps.
And who wants that?
No, it's terrible. And what that means is that your fish oil is rancid. It's old. And if you think about, fish oil sitting on a shelf in the grocery store, maybe it's sat in a warehouse for many months. Our omega is different in that it doesn't sit. It is sourced from boat to bottle. You don't get fish burps from ours. They actually taste kind of lemony.
Yeah.
You know, my grandkids will bite into them. They call them gushies. It's like a treat for them.
Yes.
And they're a very, very good fish oil. No fillers, no omega-6s, omega-3s, omega-7s, EPA, DHA, and even vitamin D3.
Right.
So
Right.
it's a great product.
Right. And so I think omegas, again, it's something that everyone should be taking, but look at your sourcing, look on the bottle, see what it's actually made of. And then I love the fact that vitamin D is added into this because, again, vitamin D is so important in your immune system. And so right now we should all be having normal or on the higher end of vitamin D levels, where so many people have low levels. So what I love about the Vitality Stack is, again, you know, it's made for everybody. It's not just made for cancer survivors, but certainly we can see how this would be so beneficial to people who are trying to get their back quality of life back as they're going through cancer. And I certainly saw a lot of that in my patients.
And so as a plastic surgeon, you told me that you recommended it for all your patients. Right?
Yeah, I absolutely do, because you know, in the world of plastic surgery, you know, people often come to us for reasons of aesthetic reasons. You know, I feel young on the inside, but I want to look young on the outside. But what we really find is that you have to treat the inside. You have to activate your body from the inside out, and that will show its youth. So my whole goal is reversing the signs of aging in all factors, whether it's from the inside out or from the outside in. And then, two, I think all of us are becoming more and more aware of prevention. Because, you know, for me, as a reconstructive surgeon, I would see patients for a year. And we would see them through their surgery, their chemo, their radiation, through all of their treatment. And at the end, they would get nervous because they've been through all of these steps and through all these hurdles to get past their breast cancer diagnosis. And at the end, they're like, well, what do I do now? You know, I don't want this to come back. I want to activate my body. I want to be as healthy as possible so I can take on anything else in the future. And I know that you felt the same having a triple negative breast cancer.
Yes. I just didn't know what to do, and like I said, you know, I searched, and for me, LifeVantage, the Vitality Stack, has really been the solution for me.
Wonderful. Yeah. So we want to thank you all for joining us today. We're looking at each month and trying to bring educational videos to you. If you want more information, please contact Therese or I, and we're so happy to provide you with some more information. We're both science geeks, so we love the education and we love the science. But mostly we're in the world of healthcare for a reason. You know, we became a nurse and a doctor because we want to help others, and we want others to live better quality of life as well as quantity of life. So we hope that this video has been helpful for you today.
And if you would like to, I'm Therese Houk, and you can find me on YouTube on Therese Houk. Dr. Glasser is Rebecca Glasser, and you can find her as well on YouTube. So you can subscribe to either of our channels or both of our channels for more information.
Wonderful.
Thanks, guys.
All right. Thank you all.